Welcome to Long Covid Doctor, an educational series for sufferers of long Covid. I'm Dr. Tim Robinson, formerly a GP for 30 years, now GP lead in 3 NHS Long Covid clinics and a GP clinical lead in Long Covid across the southwest of England. This is a talk on when is it the right time to be discharged from a long Covid clinic and how this should take place. I'm giving this talk to reassure patients that when the time comes, they won't feel abandoned. As we all know, long Covid is an enormous challenge on so many levels: physical, psychological, social, lifestyle, occupation, self-esteem, and overall resilience. Thanks to the creation of long Covid clinics, long Covid sufferers have excellent care, I believe, from clinicians and practitioners to help them cope with hopefully, and recover from their long Covid. The journey is a long one, as stated in its name, long Covid. And at some point on that journey, inevitably, there comes a time when the difficult question is asked, what more can the long Covid clinic offer? To understand and address this question, we need to go back to the beginning. Long Covid became a recognised condition, as we all know, in late spring, early summer 2020. Long Covid clinics were created nationally later that year. Their objective is to assess, confirm the diagnosis, and validate the condition. Through multidiscipline teamwork, each patient is offered an individualised selection of advice, strategies, rehabilitation pathways, bespoke care for each specific symptom, and their overall long Covid recovery. Through the long Covid journey, the patient is made to feel cared for, listened to, and believed, we hope. The design of the service is such that patients are buddied and partnered with a health professional. Patients feel cared for and massively reassured during this scary illness that they've been unlucky enough to develop. This personalised role is integral to the therapeutic success of the long Covid service at a time when the patient is having to cope with all the consequences of long Covid, the biosocial, economic consequences, along with the isolation and the sense of worthlessness and having all those things that long Covid can lead to. Despite all the care provided from the long Covid service, the outcomes, in reality, vary hugely between each patient. Some patients make a full recovery and life returns to normal. They're the lucky ones. Some patients make a full recovery, but their symptoms relapse when they're under stress or they have an unrelated viral illness. Some patients, long Covid symptoms relapse and remit forever, perhaps because they're always overdoing it in some way, or perhaps for no reason at all. And finally, there are some patients who never fully recover. Those patients whose energy continues to be less than before they had Covid, leading to fatigue and a whole variety of other symptoms, long Covid symptoms they may have. Having reached that point, we arrive at the difficult question, where to from here? As there is no clear-cut moment when we can state that a recovery has been made, it's difficult to know how the case should be managed, sort of like going forward. There comes a point when our patient has put into action all the tools and strategies that they've been taught in the Long Covid clinic, have learnt to live with the constraints and limitations that they may still have with their Long Covid. They've made the necessary adaptations and accepted the reality of their residual Long Covid. And so at that point, it's fair to say that the Long Covid clinic has offered all it can offer. And it's reasonable at that point to ask, what do we do? Do we keep buddying, partnering with the Long Covid patients for the rest of their days? Probably not. Or do we abruptly sever all links, immediately discharge our Long Covid patients? Probably not. Or do we come to a mutually agreed decision made between the patient and clinic healthcare professional to dormant the case, but with the option for the patient to be able to reconnect, recontact, and maybe re-engage if needed? That's probably what's going to happen, isn't it? Yes. And so, as I said, we're left with a choice. Keep the patient on forever, immediately sever, or dormant the case. I mean, of course, of those three options, clearly the latter option is the obvious solution, the patient-initiated follow-up, otherwise known as, or abbreviated to, the PIFU. It's less of a mouthful. So, a PIFU. A PIFU is a reassuring safety net for our Long Covid patients. It acts as a lifeline that the patient can pull on and pull in if the need should arise. It brings about great peace of mind for our Long Covid patients. The analogy of learning to ride a bike comes to mind. When you first ride a bike, you're using stabilizers initially, aren't you? For peace of mind and safety. They're then removed at a point when, you feel that it is felt, usually by the parent, that you've mastered your bike riding skills. You've learnt to ride a bike. Or in the Long Covid setting of this analogy, when you feel that you can live with the life as it is without your Long Covid clinic buddy or partner. So the key to a successful patient-initiated follow-up, a PIFU, therefore is one that is mutually agreed, between the patient and the health professional. In order to do this, obviously, the patient and the professional needs to sit down and discuss it, have it explained. The patient is then reassured that they're not going to be abandoned, that they still have direct access to the clinic, direct, emphasis on direct, i.e. they don't have to go through the GP to get back in touch with the clinic if it is needed. The PIFU remains valid for an appropriate duration, usually 3 or 6 months. I mean, various clinics vary. Some are 3, some are 6 months. Often it's a case of, if you like, again, like I've said, that mutual decision between the practitioner and the patient to decide upon what's right for that patient. If the patient has not needed any further contact within the 6-month PIFU window, it's assumed that the patient is coping with all the potential residual effects of Long Covid, or they've recovered. And at that point, it's reasonable for the clinic to be discharging that patient from the Long Covid service. If, however, the Long Covid patient at a later date needs further assistance, but the PIFU has expired, the patient can reasonably ask the GP at that point to be referred back to the Long Covid service. Most services can now offer appointments within a very acceptable time frame. The long waiting lists to be seen are thankfully a thing of the past. Some patients who have been discharged from the Long Covid service have raised concerns that they will miss out on any new treatments that will cure their long Covid. This concern is, of course, entirely reasonable, but probably unfounded, because as we know, over the last few years now, a single treatment, a miracle cure for long Covid is highly unlikely. This is mostly due to the fact that long Covid, as we know, is a multi-causal, multi-system, multi-dysfunction condition, and hence there will never be, certainly most of us believe this, a magic bullet medicine to deal with it. If, however, this is totally wrong, and there is a magic bullet that was safe and evidence-based and truly effective, this would most likely be widely broadcast on the news, certainly across the social media. It would certainly be highlighted on the NHS Long Covid Recovery website. I'm sure you know this, the yourcovidrecovery.com website. So there we are. I'm sure that the patient should feel reassured that they won't miss out on any potential miracle cure should it arise. And so that concludes this brief talk on discharge from a long Covid clinic. And so in summary, discharge and follow-up, discharge and patient-initiated follow-up, PIFU, it's not an easy topic. Concerns that patients may have are entirely reasonable and entirely understandable. No one wants to feel abandoned. A successful PIFU is one that is negotiated between the patient and health professional. So, as I've said, the patient won't feel abandoned. It's essential that the patient-initiated follow-up, the PIFU, is a mutually agreed plan in line with the whole ethos of the Long Covid service, i.e. it is a patient-centred, giving individualised care to deal with the perplexing and mysterious condition that is long Covid. So there it is. I hope that's been helpful to you. So, in the meantime, I wish you well. I wish you well in your long Covid recovery.